Of course, the patent system is a social policy tool. It's meant to bring benefit to society as a whole. The idea behind being that if you give to inventors the opportunity to benefit from their invention, you will continue to have innovation. For pharmaceutical companies, they look at this slightly differently. They use the patent system and their ability to apply for patents as a way of extending their market exclusivity. It is a mechanism to keep competitors off the market for as long as possible. That is part of their core business model. That is why they will also be very active in defending the patent system and make sure that the patents can be as strong and as long as possible. They also use the patent system to weave a complex web of additional patents. Some medicines are covered by hundreds of patents, which make it very difficult for generic competitors to decide whether they can take the risk to develop a product that would then compete with the originator product. So, for example, if you look at the AIDS medicine AZT, zidovudine, which was first synthesized in 1964, the last patent related to that molecule, which is a combination patent, will expire in 2021 in an Eastern European country. Now that shows over half a century of patents on one molecule. Of course, not all patents are blocking patents, but all of these patents do contribute to creating a web of protection that makes competition in the market difficult. Of course, with regard to AIDS medication, globally there's been a response at some point in which the drug companies have agreed to provide licenses to enable the production of generic versions, low-cost, low-price generic versions of antiretroviral medicines for use in low and middle-income countries. So in a way, for the AIDS case is a very good example of how patents have been used to create benefits for large numbers of people by making those patents available for the production of low-cost generic medicines, including very new antiretroviral drugs. We also have to recognize that that was in response to a massive global mobilization and the availability of large amounts of donor funding that became available to purchase those generic medicines. But there are lessons to be drawn from that. The Medicines Patent Pool that manages these patents for HIV medicines now also has patents for the products needed to treat hepatitis C and is expanding into other areas such as the non-communicable diseases. Cancer will likely be the next group of diseases, the next group of products that the Medicines Patent Pool will seek licenses for. The World Health Organization has added a number of significant cancer drugs to their list of essential medicines. When a product is a WHO essential medicine, that means that it has to be accessible and affordable to all in need. But the globalized patent requirements have made that today much more difficult than in the past, because these newer medicines can be patented almost anywhere. So if you don't have licenses, the access to these medicines will become available. Now, you can have these licenses in a voluntary manner, but you can also have these licenses in a non-voluntary manner, because if a company refuses to license for public interest reasons, the government can intervene, and the government can say, look, we're not getting the price that we are willing to pay you. We've tried to negotiate a reasonable deal with you. You're not giving an inch. We're no longer going to wait. We will issue the license ourselves. That is called a compulsory license or a government use license, when the government does it to be able to use the patent for their own purposes. That then lifts the monopoly effect of a patent. Generic products can be produced or can be imported. Compulsory licensing is an important, integral part of a patent law. Any good patent law will have that provision in the law, because you need, as a government, on the one hand you give the patents, but if they have undesirable effects, you also need to be able to take them to take them away, or in any case, take away the monopoly effect of those patents. This mechanism has been used on large scale by developing countries, particularly in the early days of the AIDS scale-up of treatment of people with HIV and AIDS. But today, the demand for issuing compulsory licenses is heard the loudest in European countries, even very wealthy European countries, where governments are struggling with making high-priced medicines available to people in need, particularly in the area of cancer. There's a lot of debate about that, and there are direct requests to governments by patients to move ahead and issue compulsory licenses and seek lower-priced versions of those medicines to purchase. So the patent system is the predominant system in which in our societies we incentivize innovation. It doesn't have to be like that. You could also imagine a world in which the innovation is not dependent on high medicines prices. Today we finance innovation by paying a lot for our medicines. We could also stop doing that and use that money to invest in the innovation directly. So if you would create a market for innovation by paying for the innovation directly, you'd no longer need the high prices because the innovation is already paid for. That is called delinkage. What that means is based on the notion that innovation, research and development is costly and that it needs to be awarded, but that it should not be awarded through high prices, but through direct payments. Then the innovations can go to market as generics from day one. They no longer need necessarily the exclusive rights, and the high price crisis can be solved. Now, no country can do that alone. This would require international collaboration, and perhaps time has come to do some serious feasibility studies with groups of countries to see how this would play out. There are some real-life examples of this type of paying for innovation. If you look at the Drugs for Neglected Diseases Initiative, which is a non-for-profit drug development entity based in Geneva, they have an impressive portfolio. They've brought new products to market, including a new chemical entity, entirely based on this delinkage principle. They pay for the innovation directly. The products are affordable when they go to market. And that might be the way the future is going, because the high price model has really reached the end of what the societies, what our societies can afford. And if you look at how much we spend on pharmaceuticals per year, the annual pharmaceutical market is about $1.7 trillion US. If even a small amount of that we would invest more directly in the innovation, things would start to change.